I'm Dr. Marie-Fidèle Umuhire. I am a psychiatrist. Currently, I work at Kigali Mental Health Referral Center. It's a new mental health institution. We are now like 2 years, almost 2 years. So we are new, as I told you, and we help people who struggle with mental health issues. I'm a mom, a wife. I'm practicing my job now since how many years? I don't remember. Do you know? It's a funny question. Let me say more than 5 years, but it's already almost 8 years. It's a disease. Let me say it's a disease, it's a condition women face after giving birth. After giving birth, depression is an emotional disease. So postpartum means after giving birth, and depression is that emotional disorder we have among other mental health issues we can have. Some of the symptoms are the same symptoms as the depression disorder itself. It is a sadness. The new mom can have sadness. She cry. She don't know why, but she cry. She don't feel well in her emotional. She can have also low motivation. She can have sleep deprivation. She don't sleep at night, and in this case it's very common because the new baby to face a new, let me say, a new environment. So either the mom and the baby need to accommodate themselves to know each other. There is also sometimes, due to those different situations, even the mom feels guilty. She feels, I'm not a good mother. I will not be able to do this and this. So she starts to feel guilty of herself. And that guilt is something about the symptoms. The baby blues differ from the postpartum depression due to not about the symptoms, because the symptoms are the same, but the difference is about the duration. The duration, you know, after giving birth, most common thing is it's a joyful time. But even if it is a joyful time, it is also at the same time a stressful period. So in that time, it's where we can start to see all those symptoms said before. And then the first days after giving birth, like the first day after giving birth until like 2 weeks after, it's the period we say about baby blues. But when it is from 15 days to a longer period, like 3 months, even more, because some people have more than 3 months. It's not only 3 months, but more than 15 days. It's where we start to say it's a postpartum depression. Yeah, there are some risk factors. You know, giving birth is something which can happen in the life of a woman. So before giving birth, she's already a human being, a person. She may have facing previous depressive disorder, as I told you, herself or in family. Yeah, so it is one of the common risk factors which can bring to the postpartum depression. There is awareness, but maybe not at all levels. I think there is still a lot to do, even not only in mental health consultation, because the mothers start not in mental health, they start in gynecology. In gynecology, I think there is some efforts to put in. It needs to be the doctor to go more deeply in the history of the person they have in front of them. It is especially about the emotional symptoms, that sadness we talked about, but also that irritability for someone who are not common to have that irritability. You can also be alerted with what the person, the content of what the person is talking about in that period after giving birth. Because even if it is a joyful period, as I say, it is also stressful. So to always saying like, I'm not a good mom, I will not be able to do this and this, please do. No, I don't want that children. I don't want this baby. Don't. Something like this, you can start and say, what happened to you? How can I help you? Maybe, so to see, that's why when you don't know the person even before, it's not easy. But because the nuclear family is someone, you are with some people who knows you, that's why to know there is a change is, let me say, it's more easy. But I want to clarify also something. Sometimes it's not easy as such. I say that because you can say, okay, it's not something common we know. There is a change, but we don't know what happened. And no one about those women, those ladies, sometimes they don't even say anything. They keep all for them. But they react in a manner which is different. And even if you say there is something, but you don't know, how can I explain that there is something new? There is something which changes. So it's not really easy. It is a silent disease, which it doesn't disturb, let me say, it doesn't disturb anyone, especially after the few days after giving birth or even later. And due to that non-disturbance, sometimes you can keep the mother and say, okay, maybe I missed the word in English, but it seems like there is no disturbance. So even the person will not see looking after you. But it's a time to say, to ask yourself, what happens? Is it something wrong? May I help you in another, in a way or in another way? So not saying it's not something which disturbed me, because it's not disturbing me, let me keep the person there. So that's why I say, even if the alerting clue you can have, it's not really easy, but you need to keep attention and ask maybe the person. At all level of health institutions, they have mental health professionals, starting at the lowest level, health center, district hospital, referral hospitals, there where they can find help. So at those levels, they can find help with medication, psychological support, but not only those psychological support only. At lower levels of institutional, they can have also um, people who can even come at home. It's not, let me say, accessible maybe at all levels, but it is possible even if here in Rwanda, especially in Kigali maybe, more in Kigali than in rural areas. And also here I was talking about in the level on mental health, because as I told you, the women start in the Gyn and Obs department, and there is nurses, midwife who follow them after giving birth. So even there are those support even before giving birth or after giving birth. I can say it's not something new. It's not something which happens to you. You are not alone, but it's possible to have support. Support from health care professional. You can be, don't hesitate to tell first your husband or your sibling, your elder sister, your mom, if you have your aunt, and seek for help. I say that because I emphasize about that message that depression, it's not a condition which is not treatable. It is treatable. But many people don't know. That's why I call for that urgent message. It is treatable, so don't hesitate to seek help.